Signs of an unhealthy baby in the womb. Number 1. Abnormal fundal height. Fundal height helps the doctor evaluate whether a woman's uterus is growing or not. After the 16-week mark, fundal height matches the progress of the pregnancy. If the height of your uterus is not what it should be, it indicates a problem with your pregnancy. The reason may be too much or too less of amniotic fluid or a breech baby. Number 2. Lack of or no heartbeat. Baby's heart starts beating after the 5th week. It's only around the 6th week that detection becomes easy. A fetal heartbeat can be detected through electronic fetal monitoring or by using a fetoscope or stethoscope. In some cases, by just touching your stomach and counting the number of beats per minute. However, if she still can't detect the fetal heartbeat, then an ultrasound test might be recommended. Lack of heartbeat signals a hindrance in fetal development or a lifeless fetus. 3. Intrauterine growth restriction, UGR. Intrauterine growth restriction interferes with the growth of the fetus. If you are diagnosed and have IUGR, it implies that your fetus measures at least 10% smaller than its gestational age. If you're suffering from IUGR, complications such as difficulty in breathing and high blood sugar may be the cause and continue even after delivery. This problem happens due to abnormal functioning of the placenta. Number 4. Low HCG level. HCG is a type of hormone produced by the placenta during pregnancy. HCG levels tend to fluctuate throughout pregnancy depending on the trimester. HCG levels are extremely high from 9 weeks, 16 weeks of pregnancy. The normal levels vary from individual to individual, so a low HCG level is not a reason for you to panic. However, miscarriage, a blighted ovum or ectopic pregnancy may induce a low level of HCG and raise a red flag for your pregnancy. 5. Excess cramping during pregnancy. Pregnancy comes with its share of pain and aches. However, extreme pain, which feels like menstrual cramps, is another warning sign. In early pregnancy, if you feel excess cramping, you might need to consult your doctor. 6. Bleeding during pregnancy. Spotting during pregnancy is not normal. However, bleeding is still a matter of concern. It might be a sign of miscarriage, hormonal bleeding, or implantation bleeding. Number 7. Extreme back pain. Experiencing back pain is common during pregnancy, as the growing baby puts a lot of strain on the spine. Number 8. Vaginal discharge during pregnancy. Vaginal discharge is a common condition experienced by women when they're pregnant. Usually, the vaginal discharge of a pregnant woman is clear, transparent, whitish, and odorless. The unusual discharge might be caused by cervical inflammation, a sign of miscarriage. 9. Sudden discontinuation of morning sickness. Morning sickness resolves itself by the end of the first trimester, or even earlier without affecting the fetus. Sudden discontinuation of morning sickness might be because of low HCG levels pointing to a miscarriage. Number 10. Fever during pregnancy. Fever during pregnancy should not be ignored. A fever might pose the threat of a bacterial or viral infection to the fetus. 11. Contraction of breast size. During pregnancy, the body of a woman goes through a multitude of hormonal changes. Breasts go through a transformation and become more sensitive. They also feel heavier and fuller as the pregnancy progresses. However, a sudden decrease in the size of breasts may signal a miscarriage. Number 12. No fetal movement. Fetal movement can be felt around 20-24 weeks in first-timers. As the fetus starts reacting to sound, light, and pain, experts say that a pregnant woman should experience at least 3 kicks every hour during this period. 13. Sudden spike in blood sugar levels. It's normal for blood sugar and blood pressure levels to decrease during pregnancy. You should keep these levels throughout the 3 trimesters. However, diabetes can cause sudden intrauterine death, and raised blood pressure can cause premature separation of the placenta. Number 14. Changes in placental position. An abnormal placental position is also one of the signs of an unhealthy pregnancy. When the placenta detaches prematurely from the uterus, the pregnancy gets terminated, so always get your placental position checked. Thank you for watching. Please consider giving it a thumbs up and subscribing to our channel. Drop your thoughts, questions, or video suggestions in the comments below.